when Ebola broke out in Liberia in 2014, Partners in Health was invited by the government of Liberia to join their response. From 2014 all the way to 2015, there was a lot of focus around the response. But we as an organization, it was very obvious to us as we got there, we realized that was a system, hit by 14 years, of civil war, where most of the healthcare workers who were working in this system either died or had to leave the country.
Can you share some insights to the strategy that the organization adopted?
Everywhere we work around the world, in the 11 countries we work around the world, more than 95% of all our staff are always hired from the community. So when we say from the community, they can be TB survivors, they can be Ebola survivors, they can be anything, because we live with the communities, we serve, we break bread with them, we stay with them. So it is a part of our DNA.
How did the strategy evolve after Ebola?
After Ebola, when Liberia declared, Ebola free in 2016, all the focus was around health system strengthening. And Partners in Health made that call to stay, to work alongside the government of Liberia and the Ministry of Health, more specifically, to rebuild the system. And how did we do that? We know that you cannot strengthen any system without strengthening the people working in the system. And as part of our strategy, we've invested in what we call the 5 S's. The first S is staffing, in quality, in quantity, in order to provide safe and quality care for folks. The stuff can be all the equipment, all the diagnosis tools you need to work in the system, in the healthcare system. We invest in social support because we tend to work in, the most impoverished communities where, for example, in Liberia, folks are living when they are less than $1 per day. They're willing to accompany them and make sure they succeed for any, disease or thing they are dealing with. We want to make sure we address some of the social determinants of special diseases they are dealing with. We invest in dignified space to provide quality and respectful and dignified care to people, and we invest in system to build the capacity of the people living in the country, because we strongly believe investing in what we call the human local capital is the way to go, because we strongly believe it is the responsibility of the locals and to work alongside the government to make sure basic primary health care, are available for everyone. And therefore, we partner with academic institutions, including Harvard, Brigham and Women's Hospital, the local universities, nursing school, midwifery school, to build the health workforce with local Liberians to ensure we have a system that is strong and stable enough and resilient enough to respond to future public health events.